Congratulations on having a successful surgery. For optimal healing, there are few instructions to be followed to minimize the complications. So the first thing is, as you had the tooth out now, you will be numb for a certain amount of time. It could be from 1 hour up to 4 hours. So while you're numb, you need to be extremely careful that you don't bite onto your lip, your cheek, or your tongue. Actually, try to avoid anything which requires chewing or biting. You might accidentally bite your lip or your tongue there. So next thing is bleeding. Bleeding is expected for, depending on the surgery, it could be up to 2 days. So we want to minimize the bleeding, and first thing to avoid that would be avoiding spitting. The more you try to spit it out, the more it causes pressure and makes it bleed. So spitting is an absolute no till the bleeding is completely stopped. If you're biting onto a gauze, if the dentist has put the gauze for you, keep biting onto it for at least 1 hour. This helps in putting the pressure and controls the bleed. If in case the bleeding is too much, you will be supplied with an extra piece of gauze which you can replace after an hour and continue biting for another 1 hour. Alternatively, you can use a tea bag to bite onto. This helps in controlling the bleed better. With regards to pain, depending on the surgery, pain could be very minimal or it could be bothersome, which could last up to first 4 to 5 days. Pain usually becomes more severe after day 1. So you will be recommended with the pain medications. Please follow as instructed by the dentist. One thing we strongly want to avoid is prevent any infection in that area. Mouth being wet, food passing through could catch into that areas and cause infection. So once the bleeding is completely stopped, you can start cleaning that area using either a mouthwash if recommended by the dentist, or using warm water with a pinch of salt. So taking half a cup of warm water, lukewarm water, adding a bit of salt in it, just a pinch of salt, and using it to rinse that area will help to keep it clean, which will help in healing it faster. If the dentist thinks that you need antibiotics, and if the infection was quite large, you'll be prescribed with antibiotics and you need to take it accordingly as the dentist has instructed you. For more complex tooth removals, there could be swelling expected. Swelling usually starts the next day after the surgery, and it could keep going up for next 3 to 4 days before it starts coming down. So if it is a complex tooth removal like a difficult wisdom tooth, you can experience swelling for the first 1 week. In the second week, it disappears, and by the end of second week, you're almost fine there. Due to the swelling, you might have difficulty in opening your mouth. Swallowing could be difficult, so please don't worry, that's expected. However, if the swelling is settled down and it's coming back again, that's a sign that it's probably getting infected and you need to see the dentist promptly. Next thing is, if there are stitches put in there, they could be either the ones which dissolve by themselves or the ones which are required to be removed. So the dentist would let you know what kind of stitches has been put in there, and if in case they require removal, you are required to come back 2 weeks from the day of the surgery for the removal of the surgery. So this would be booked for you in advance while you're leaving the surgery. With regards to diet, you can have anything which is for the first 24 to 48 hours where the bleeding is expected. So anything hot you eat in temperature will make it bleed more. On the other hand, if you're having anything cool, that helps in controlling the bleed. So what I would recommend is having things like yogurt, jellies, ice cream for the first 24 hours, which helps in controlling the bleed. Once the bleeding is stopped, you can gradually start moving on to the regular diet. So with regards to habits such as smoking, smoking does affect the quality of healing, and it would be best to avoid smoking for the next 4 weeks so that you can avoid any complications. In some situations like a wisdom tooth removal or a bottom back tooth, it is even more important to completely avoid smoking for the first 4 weeks because it could cause complications such as dry socket, which is an extremely painful thing. Also, it's important that you leave that area to itself. Don't try to touch it. Don't try to feel it with your tongue. Don't poke your finger in there. Don't try to check it too much. Yeah, just try not to disturb the wound, especially if you're having stitches. Your tongue will like to go and play in that area. Consciously avoid it. Also, it's extremely important that you keep yourself hydrated so that the healing goes well. If in case there are situations where a bone graft has been performed, it's extremely important you continue keeping that area extremely clean for the first 2 weeks till you have your next check. So once the stitches is out, then the dentist might recommend you to continue with the mouthwash, or depending on the healing, the instructions will be given. So all in all, it's extremely important that you need to be very kind to that area where the surgery has been done, and it should be taken care of. Thank you.